The Democratic field in many ways on healthcare is kind of divided into a Medicare for all and a public option. You land on the Medicare for all side of that spectrum. Um, I'd like you to walk through in detail how you pay for it.
To me, the confusion around how we pay for healthcare misses the central point, which is that we're already paying through the nose for our healthcare in so many ways. We pay for it through higher prices. We pay for it through the fact that millions of us can't change jobs because we're afraid to lose our healthcare. We pay for it because it's the number one cause of bankruptcy for families. And we pay for it because it's much, much harder to start a business without having your healthcare being secure and provided for. It's one reason why new business formation rates are at multi-decade lows in 80% of the country, including right here in Iowa. It also misses the fact that we're spending 18% of our GDP, over $3.6 trillion on our healthcare right now, twice as much as other countries, to worse results. Now, how can this be possible? Part of it is that 30% of the $3.6 trillion we're spending is waste. But a lot of it is because our healthcare system is not actually designed to make us stronger and healthier. It's designed to maximize profits and revenues for the drug companies, the device companies, and the private insurance companies. The way we, quote unquote, pay for it is we actually start trying to align the incentives and the resources that are being put to work to actually be dedicated to patient care, which they are not right now. I had a friend who's a genius at numbers go through the numbers of, well, she did it independently. I didn't ask her. She just did it because it's her job. But she looked at the numbers in the healthcare industry, and she said she has never seen price gouging, profiteering, and the profitability levels that she saw in the drug companies, the device companies, and the private insurance companies. She said it's completely unsustainable. So that is what the American people sense instinctively. When's the last time an American got this news from their insurance company? Great news, your premiums have gone down. That has never happened to any American, ever, because their entire business model is just to ratchet the prices up year after year. It has reached an unsustainable point, and the American people understand that.
A lot of other candidates, maybe sitting in the same chair, have talked about needing to flip the incentives in healthcare, so it's about well care instead of, just treating you when you're
Activity,
sick.
yeah, revenue.
Activities, outputs. But we see a little change year after year. How do you really flip those incentives?
Well, you try and find what has worked out there in the real world. And so I'm inspired by the success in the Cleveland Clinic, where they began paying their doctors and providers based upon essentially a market salary. And then what you saw is that those doctors prescribed fewer drugs, decided that fewer procedures were necessary. And this was not negative for patient health and outcomes. It was actually positive. And it saved money because it turns out if your incentives are not tied to level of activity, then you look at a patient and say, you know what, I think you might be able to go home and just have like a wellness regimen or see a physical therapist or do something that doesn't involve cutting you open and spending tens of thousands of dollars. We're human beings. We respond to structural incentives. If you're a physician and you get paid more based upon how many procedures you perform, then your natural inclination is to say, a lot of people seem to need a procedure around here. If you're getting compensated independent of that, then you use a clinical judgment set that might lead to better outcomes. So a lot of it's tied to compensation of doctors. There is another model that has worked, aside from the Cleveland Clinic. It's a capitation model, where you go to a hospital and say, okay, how many people do you serve? What are the average costs for serving people in your market? We're going to essentially have you have relatively constant revenue flows and compensation, and it's up to you to try and make the best possible use of that to make people stronger and healthier. So there are things we can do immediately at the margins. Healthcare is 18% of our economy, and one thing that I'm concerned about, and I think some of the other candidates are concerned about as well, is that you can't make wholesale changes to 18% of the economy without causing real disruption and pain in various communities. One number, as an example, there are about 660,000 Americans right now who work in private health insurance. So if you were to have a plan that says, hey, we're going to get rid of private health insurance in 100 days, then you're literally saying we're going to fire 660,000 Americans in several months. And you can have whatever feelings you have about private health insurance, but the 660,000 people who work in private health insurance are just everyday Americans who wake up and go to a job. They're certainly not witting participants in some, something that's negative for the American people. They're just people who live in Hartford or people who live wherever, and they just wake up and go to their job like any other. So you have to be judicious about the pace and scale of the changes you make. But I'm 100% confident that we have ample resources in the system because we have so much excess in the system right now.
Today, you're rolling out a more detailed plan to rein in the cost of prescription
Yes.
drugs. Part of that, you say that if a company won't give a drug at a reasonable price, that you'd license that to another company to produce that drug.
You actually, the government itself would have a manufacturing facility and would forcibly license it directly.
What's sort of a reasonable amount for a drug company to make on a drug or as a profit level?
It wouldn't necessarily be tied to their profit level. It would be tied to what they're charging us relative to what they're charging customers in other countries. Because right now it's commonplace for a drug company to charge us 2, 3, 4 times more than they're charging citizens of other countries, despite the fact that in the vast majority of cases, the American taxpayer subsidized the development of these drugs, or at a minimum subsidized the FDA evaluation of the drugs that prepared them for market. So if they decide to gouge us relative to the price in other countries, then any reasonable American would look up and say, okay, there's something wrong about that. I'm not against companies being able to make a reasonable return on their businesses. I mean, I've run businesses myself, but the drug companies have taken it to an all-new extreme, and they need to have some kind of monetary incentive to keep their prices under control. They only respond to dollars and cents, essentially. If we stood outside the drug company and said, do the right thing, we could say that every day, forever, and it would have zero impact. But if you said, hey, this is going to impact your shareholder returns and shareholder value, then all of a sudden their behavior would change.
Because